Hello, welcome everybody. This is Daniel Van Sant speaking. I am the Director of Disability Policy at the Harkin Institute and excited to be your moderator slash co-host for this afternoon's webinar. As a brief visual description, I am a white man in my 30s. I'm wearing a dark blue suit, kind of a lightly patterned gray and white shirt. Not visible on my screen, but always important. I have a physical disability myself, and I always like to share that when given the opportunity. And I want to thank all of you for joining me and our speakers and panelists today for this really important conversation. As many of you know, this month marks the 80th anniversary of National Disability Employment Awareness Month, which we celebrate every October. And this year's theme is celebrating value and talent. So we're really excited in service of this theme to be collaborating today with the PROPEL Center at the American Institutes for Research on this webinar about the National Training, Education, and Workforce Survey data. This is the first time that this data will be presented in this way, and we're all excited that you have joined us for this conversation. As some housekeeping measures, hopefully you have noticed that we have CART as well as American Sign Language provided for this webinar. If you have any problems with either of those, please use the Q&A feature to bring that to our attention so we can troubleshoot behind the scenes. I want to make sure that people are aware this webinar is being recorded. And the recording will be archived and available on the event page of AIR. After the presentation, they will also be posting a 508 compliant PDF of the slides on that same website. So make sure that you enjoy today's conversation, but also share the recording and PowerPoints around your networks when we are done. I also want to make sure that people know we do not allow AI bots to participate in the webinar. So if that seems to be happening, they will be removed from attendance. But as I said, recordings and PowerPoints will be provided afterward for people to use at their leisure. And finally, we are disabling the chat for attendees in this webinar for accessibility purposes. And we're not taking live questions on camera here, but we'll be responding live to questions posted in the Q&A. So please do feel free to put questions into the Q&A chat, and myself and the other panelists and speakers will be addressing those through the Q&A feature. And if you have any technical difficulties at all with the questions with Zoom, with accommodations or accessibility, please use the Q&A feature, and our tech coordinator will help troubleshoot that on the back end. So with that, I'm excited to pass my virtual microphone now over to Kathleen Murphy to introduce the event. Welcome, Kathleen.
Thank you, Daniel, and welcome to everyone here. I've been scrolling the participant list and I'd see some familiar names, so thank you for coming and supporting this event. So I'll introduce myself first. Some of you know me, and others don't. I'm a white woman with shoulder-length blonde hair. I'm wearing blue reading glasses, and I have on a turquoise and white pattern dress with short sleeves. So I am a managing researcher at the American Institutes for Research. And in that position, I hold a number of roles. So some of you may connect me with the National Institute on Disability, Independent Living, and Rehabilitation Research, the funded knowledge translation centers. So I've supported you, and we connected earlier with the Harkin Institute for the Center on Knowledge Translation for Disability and Rehabilitation Research. And in some years past and currently, I also direct NIDLR's center that supports the employment grantees specifically. So I'm here today, though, in my role leading a project for AIR's Propel Center. I'll explain more of that later in the event. So what we're going to do during this hour together is talk about another co-sponsor of this event, AIR's employee resource group, AIR Access, which is our disability-oriented research at ERG. I already mentioned we'll go over what the PROPEL Center is and how they're involved. Then, of course, the highlight of the hour will be Juanita Hicks presenting on the National Training, Education, and Workforce Survey data, specifically as related to disability respondents. And then we'll have the panel discussion, do what we can to address your questions, and Daniel will close us out. So I think we're going to hear next from our chair of Access ERG, Perry Gorlick.
Thanks, Kathleen. Hello, everyone. Thank you so much for attending. My name is Perry Gorelick. I'm the chair of the Access AIR Employee Resource Group here at the American Institute for Research. I am a white male, clean-shaven with dark brown curly hair, wearing a dark blue quarter-zip sweater. Access AIR is so proud to co-sponsor today's Data in Action session alongside AIR's PROPEL Center and the Harkin Institute for Public Policy and Citizen Engagement as AIR's 2025 observance of National Disability Employment Awareness Month, or NDEAM. At Access AIR, our mission is to advance disability inclusion and accessibility across AIR. We bring together employees with disabilities, allies, and advocates to share experiences, raise awareness, and promote practices that make AIR a workplace that ties in with the NDEAM theme. Celebrates the value of talents of all employees, including those with disabilities, through collaboration, education, and community engagement. Our goal is to foster a culture of advocacy, awareness, and belonging, where staff, family members, clients, and visitors with disabilities, as well as those who benefit from accommodations, are supported and empowered. We're especially pleased to be a co-sponsor of this event, and we welcome our Access AAR members to join us in learning more about the National Training, Education, and Workforce Survey. Today's session will explore data on the experiences of people with disabilities related to non-degree credential attainment, work-based learning, educational attainment, and employment. Our hope is that these insights will not only deepen our understanding of workforce inclusion, but also help guide how we advocate for employees with disabilities here at AAR, ensuring equitable access to training, opportunities, and accommodations for all. And now I'm going to turn it back to Kathleen to introduce PROPEL Center as our co-sponsor. Thank you.
Thank you, Perry. So AIR, some of you may be familiar with it, some of you may not. We're a large organization, we're a nonprofit, and large, I think we have about, around 1,000 employees. We have offices, particularly, we're headquartered in Crystal City, Virginia, but we have large offices also in Chicago and representation from all over the country as far as staff. I'm calling in from Austin, Texas, for example, where we have a small office as well. So AIR does a variety of research, training, dissemination, technical assistance projects. And one thing that's somewhat unique about AIR is that we have a quasi-endowment fund. We have internal funds that support specific initiatives that are important to AIR and its staff. And one of them is the PROPEL Center. So the PROPEL Center, which is housed in AIR's Employment and Economic Opportunity Program area, it stands for Promoting Resilience, Opportunity, and Progress in Employment and Learning Centers. So these NTEWS analyses are supported. They're one of the PROPEL Center projects. Overall, the PROPEL Center is really focused on creating a stronger workforce, testing, applying proven workforce strategies in different settings, looking at what works best in local conditions for various groups. So it has 4 different branches of work. And one of them is learning from the evidence. So it's a very new project, the N2 analysis project. So we don't have a presence on the PROPEL website yet, but we will. So I think they would probably be housed in the Learning from the Evidence initiative. But PROPEL also works on strengthening community college partnerships and workforce development, expanding sector strategies and effective sectoral training, and supporting individuals and communities in economic empowerment. So thinking about the Propel Center and the tie that it has to this NTEWS, we really wanted to be responsive to what is going on, the zeitgeist that we have in the employment field generally, and then use these data that Juanita Hicks will talk a lot more about to think through, okay, let's focus on those items that have to do with credential attainment, workplace experiences, uh, apprenticeships, things that are going on in the workforce generally, and what's happening with people with disabilities as related to these overall initiatives that are national priorities. So that's where we can continue to work with any of you if you're interested specifically in the disability analyses, or if you're thinking, no, I would like to see all of the NTEWS aggregate data, or I want to look at a different subgroup, you can absolutely reach out to me and we can have a conversation about that. So I think you probably now want to hear about the NTEWS, so I'm going to turn that over to Juanita.
Okay. Good afternoon, everyone. Thank you for joining us for today's event, Data in Action, New Findings from the National Training, Education, and Workforce Survey, affectionately known as NTEWS. I am Juanita Hicks, and I'm a senior researcher here at AIR. For those who can't see me, I am a Black woman wearing 3 earrings in each ear and my hair in 2 French braids. I also have on a long sleeve black turtleneck shirt because it's finally cooling down where I am in Texas. So today, like I said, we're really excited to share insights from the NTEWS with a special focus on disability status and workforce outcomes. And slide. There we go. Okay. So what is NTEWS? Well, NTEWS is a uniquely focused survey about capturing data on the skilled technical workforce and individuals with non-degree credentials. The survey, as it stands, the results that we are presenting to you today come from a sample of about 15,000 individuals between the ages of 16 and 75. All of the respondents at the time of the survey were not in high school and included those who reside in United States and Puerto Rico. Some of you may be familiar with the American Community Survey, the ACS, and so the ACS serves as the sampling frame for NTEWS. So what makes NTEWS unique, like I said, is its focus on the skilled technical workforce. And these are the people that are highly skilled in science and engineering fields. And the NTEWS survey covers a bunch of different topics, but mainly educational enrollment and attainment, non-degree credential types like vocational certifications or certificates, and occupational licenses. Also work experience programs like apprenticeships and internships, and then also employment and demographic characteristics. Sorry about that. Slides are a little slow. I just have to be patient. So NTEWS complements a few other surveys that are currently on the market right now, and those 2 surveys are the National Survey of College Graduates and the Survey of Doctorate Recipients. Of course, as the names suggest, these are surveys that are specifically for people who have graduated college or obtained doctorate degrees. And so what the NTEWS does, it offers similar services, but it provides new data on the workforce who do not have a bachelor's degree or higher. So we're able to get at that particular group. I also want to note for the results that we are presenting today, the 2022 NTEWS is a first cycle pilot that was released in the spring of 2024. So what that means is that these are estimate and experimental statistics that are used to help refine future surveys. So they are not official. That doesn't mean that you can't use them though. They still offer valuable insights and can still help users explore the usefulness of the variables in the survey. But I just did want to note the limitation that because these are not official statistics, just please be aware of the limitations that come along with that. And okay, sorry, Shoshana, it's really delayed on my end, so we'll take a look at that. I also want to share also on this slide, there are a few links that will be pushed out in the chat for you all, but there are already some published tables and statistics in certain areas like employment or career and technical education and preparation for work. So you can, if you all are interested, you can visit those links to see what is already published about the NTEWS in those particular areas. All right, so now we are going to talk about the NTEWS disability categories, which is the focus or half of the focus of today's session, and the sample size of those people. So the NTEWS has 5 disability categories that measure the degree of difficulty in seeing, hearing, walking, lifting, and cognition. These are the same categories that are used by the US Census in its American Community Survey that focus on functional limitations, not medical conditions. So notably about 45% of the sample, or about 7,000 respondents, were identified as having some form of a limitation by reporting slight, moderate, severe, or unable to do to the degree of difficulty variables. So respondents were included in the disability category if they responded or reported to at least one of those levels for each of the seeing, hearing, walking, lifting, and cognition variables. I also want to point out too that when we get to the analyses and that we see the group 4 disability, that includes people obviously who can belong to more than one disability category. So the results are not broken out by specific disability, but just if anyone has reported any level of limitation or disability, they are included in that disability category. All right, so now we can move on to our first of 6 research questions that you will see today. So while it sits on the slide for just a second, I just want to make a point too about the analyses that you will see or hear in this presentation. Some of the analyses are presented in terms of statistical significance, meaning that we're checking to see if the results we found are likely real and not just random chance. So for some of the slides, I will point out if the results are statistically significant. For majority of them, I won't because they are not, spoiler alert. I also want to point out that just because a result is significant, it doesn't mean that the effect might, is large or important or even practically meaningful. Sometimes in large samples, as we have here with NTEWS, a difference that is statistically significant still might be very trivial. But on the other hand, you might find important or substantively important differences that might not reach statistical significance, but are still worth exploring. And so for a few of the results, I will also point that out. So now we can dig into the slide. So our first research question explores the current employment status of people with a disability compared to those without. And so the first variable we looked at in this research question is labor force status. So for labor force status, the levels are defined as employed, which are those that are currently working, unemployed, those who are not currently working, but are looking for work, and those that are not in the labor force, which are those that are not currently working and not looking for work. I just wanted to clarify the difference here between unemployed and not in the labor force by those levels. So the key findings for this particular variable is that there is a significant relationship between labor force status and disability status, such that the employment rates are lower for people with disabilities, but higher for people with disabilities that are not in the labor force. So if you take a look at the dark blue bar, which is in all slides, that will be the disability category. We see that there is a lower percentage of people with disabilities, 57%, compared to their non-disability peers, 75%, in the employed response. But when we look not in labor force, we see there is a higher percentage of people with disabilities, 37%, compared to their non-disability peers, 21%. And then we look at unemployed and we see they're very similar in that particular response to this variable. So next we looked at industry. So these are various industries in the NTEWS. There are 15 industry categories, but we just wanted to highlight a few of the industries here and provide some context for why we chose them. So the industries that we've highlighted are manufacturing, retail, professional services, educational services, and healthcare, and then also like a large group of occupations that are labeled arts, accommodation, and food services. And so according to the 2024 data from the US Bureau of Labor Statistics, there are certain industries that have a higher representation of workers with disabilities. And those industries are manufacturing, retail, professional and business services, education and health services, and leisure and hospitality, which you will see are very similar to the one that NTEWS provides as well. And so when we look at these particular industries, we can see that, for example, the educational services and healthcare industry has the highest proportion of workers with disabilities, again, dark blue bar, across all 4 industries. And in general, it is the industry that employs the highest percentage of people with and without disabilities. But if you look at the other 4, which are manufacturing, retail, professional services, and arts, accommodation, and food services, you'll see that in those 4 industries, for the most part, there is a higher percentage of people with disabilities, so the dark blue bar, compared to their non-disability peers, so in the light blue bar. So in those 4 areas specifically, we see a higher percentage of people with disabilities compared to non-disabilities. But in educational services and healthcare, again, across the disability status, we see a large group of people there. So for some of these industries, there are several factors that make them more accessible and attractive to people with disabilities. So if we look at the manufacturing one, for example, there have been labor shortages in manufacturing that have prompted employers to broaden their hiring practices, which would include people or more people with disabilities. There's also been automation and assistive technologies that have reduced the physical barriers and enabled more inclusive work environments, again, for people with disabilities. And there are also like specific training programs sometimes that are designed for people with disabilities to help them gain relevant skills in some of these areas. So there is room, or at least the data suggests that there is room for industries to sort of open the doors to either employ or recruit more people with disabilities, or at least areas where we have found there to be a larger percentage of people with disabilities in particular areas. Okay, so moving on to earnings. So these earning categories are split, earnings is split into different categories. And what we have seen in general is that earnings are lower for people with disabilities. There is a higher concentration of people with disabilities in the 2 lower earnings categories, the less than 20,000 and the 20,000 to 50,000. And so there are also a few things to think about here to help frame this particular slide better. One of them is that we often see that people with disabilities are concentrated into lower wage industries, sometimes due to barriers with education or training and even hiring discrimination. We also understand that for those that are receiving Social Security disability benefits, for example, they may also worry about losing them if their earnings go above a certain income cap. And also, unfortunately, there are still some wage policies that allow for people with disabilities to be paid below minimum wage. So those factors or points and other things can maybe are also contributing to what we see here, that people with disabilities are generally concentrated into those lower earning categories. But overall, for research question 1, we looked at 3 variables. There are more, but again, we only have a 30 or so minutes, so we can't show everything for the NTEWS, but just highlight a few things. We looked at 3 variables that are related to employment status, which were labor force status, industry, and earnings. And the exploration of these variables are crucial for understanding workforce participation and even any potential barriers. All right, so moving on to research question 2. We wanted to examine or explore the enrollment status and educational background of people with a disability compared to those without. So the first variable we looked at was educational attainment. This is a condensed variable, so that's why you only see 3 categories. What makes this condensed is that the below BA, so bachelor's, below BA category includes a bunch of other categories such as less than high school only, vocational certificate, some college, and also associate's degree. So all of those levels are included in the below BA category for context. So key findings for the educational attainment, this is as reported, what is the highest degree that a respondent has earned. There is also a significant relationship between educational attainment and disability status, such that people with disabilities are more likely to have an education below a bachelor's degree. That's what you see in the bars, the dark blue bar on the left at 75%. And they're also less likely to have education at BA or above. So given the results of this slide, some of this may also be related to the earnings slide where we saw that the earnings were generally lower, again, for people with disabilities. And then there are a few other slides as we go through the presentation. I hope that you all might be able to sort of see a pattern that is happening with the results that we are going to be explaining. So next we looked at the current enrollment rates after high school. So if the respondent was enrolled in any program after high school, and if they were enrolled, was it part-time or full-time? And we're showing these 2 slides together because they have similar results, meaning that the percentage of people with disability and without disability, the distributions of them for their responses are very similar across each of the variables. So if we look at the graph on the left, we see that regardless of disability status, most people have responded no, that they are not enrolled in a program after high school. And if we look at the picture the chart on the right, again, regardless of disability status, most people have responded that if they were in a program, they are enrolled in a full-time program more than a part-time program. I also want to point out too, as we move on, some of the patterns that you'll see that regardless of disability status, respondents are answering very similar. And then there are some questions where there might be a shift. And so that is where, even if those shifts are not statistically significant, it still may be worth exploring. And that's what I mentioned earlier. It still may be important to you all, even if something is not statistically significant, that you've seen something that is worth exploring. So next we looked at the variable enrolled in a degree program. So this is this variable is different from the educational attainment variable. That was to determine what degree was attained by the respondent. This is to determine if a respondent is enrolled in a current program, what program are they enrolled in. So we see that the percentages are mostly similar across disability status and the various degree programs, but we see that there is a higher concentration of people with disabilities in the in associate's program or bachelor's levels program. And these results are similar to what we saw for educational attainment, where about 75% of people with a disability were in the below BA category. So it seems that their educational attainment and then also their enrollment in a degree program are very similar. So next we thought about, okay, well, if people are enrolled in programs part or full time, or they have degrees based on their educational attainment, are their degrees used for the current or main job that they have? And it says main job because in the survey, you can list more than one position. And so for here, we're just focusing on what respondents consider to be their most important or their main job. So here we see that people with disabilities, they are more likely to not be working and also not use their degree for their main job compared to their non-disability peers, and that those without a disability, the light blue bar, are more likely to use their degree for their main job compared to those without disabilities. So not a statistically significant result, but maybe worth some interest or further exploration. And then I was thinking also for this slide, it will come up in other slides too. You'll see sometimes that there are some maybe important patterns in the way people with and without disabilities respond to certain questions about earnings or the degrees or certifications they have and whether they're related to their current job or future educational outcomes. So overall, when we explored these variables such as educational attainment, enrollment in degree program, and degree use for main job for research question 2, these can help us identify if there are educational gaps or maybe even opportunities for targeted support. All right, so moving on to research question 3. So this is the shortest research question. It just explores the background variables or the background characteristics of people with and without disabilities. So for gender, we see that the distribution of disabilities across gender is very similar. This is something that you all have probably seen in other surveys, or you can see in other surveys, so we won't spend too much time here. Then we also looked at veteran status and race ethnicity. And again, for this slide, we showed the results together because the patterns are similar. The distribution is similar across veteran status. Also that the majority of people never served in the military across disability status. Those bars are the highest. And when we look at race and ethnicity, we also see that the distribution of disability across race and ethnicity is similar, but the majority of people are white, or the majority of the respondents in the survey across disability status are white, and continue and so on. So even though there's nothing significant to show here, looking at the variables, background variables like gender or veteran status or race ethnicity are still very essential though for research focused on expanding opportunities and improving lives for just the general public and for all. All right, so moving on to research question 4. So I'm going to take a little bit of time because there's a lot of information on this slide and I want to make sure I explain it clearly and carefully. So we examined a set of 11 variables, which are the sub-bullet points on the slide. So required for a job, do more in your current job, earn more money, pursue passion, exploring interests in a new job or field. Those variables. Those 11 variables are related to 2 questions in the NTEWS survey. The first question is reason for choosing your field of study for your vocational certificate, and the reason for choosing the most important license or certification that a respondent has. Excuse me. Again, for the second question, the most important license or certification in the NTEWS. I think it asks you for your first or your most important and your second most important. So for those who have more than one, they can respond to both. We only explored this variable for the most important license or certification that a respondent provided. And so each of those 11 variables are found in both of these questions, and we wanted to explore them across both questions. But we didn't want to present to you 11 variables for one question and 11 variables for the second question. So we just sort of split them in half. So the 5 variables on the left are explored in the first question, dealing with vocational certificates. And the 6 variables on the right were used to explore work credentials, which are licenses and certifications. So on the next 2 slides, I will highlight a few interesting patterns that we found while exploring all of these variables. All right. So this is where things may get a little tricky and technical. So if you have follow-up questions or something is unclear to you, please put it in the Q&A as I go through this section. So the chart on the left show the results for one of the variables, which is do people or the reason for people getting their vocational certificate was required for their current job. So it's just one of them. What we found is that 9 out of the 11 variables I previously spoke about had similar patterns, and they all looked like the chart on the left, where those with and without disabilities were higher on the response for no, meaning they did not choose the vocational certificate because it was required for a current job, and very low on yes, meaning they did not really use or get a vocational certificate because it was required for their current job. So I want to set the stage there. The majority of the responses to this were, no, we're not getting this certificate for any one of these reasons, and it did not matter across disability status. But the chart on the right shows a slight shift. This is where I was talking about before. Not statistically significant, but still might be something worth exploring or further exploring. So this is where we see something that's a bit interesting. Here we see that for people with a disability, dark blue bar, they respond to this question that their vocational certificate was required to get a job, and they said no, at a higher rate than their non-disability peers. But when the answer to this question is yes, we see that people with the disabilities have now responded at a lower rate compared to their non-disability peers. So in essence, basically what this chart suggests is that people without a disability are saying that they are using their vocational certificate because it's required to get a job. And for the most part, people with a disability are saying that they did not get a vocational certificate because it was required to get a job. And so that means that, but it's suggesting, again, further exploration, that there is a difference there's a difference for people with and without disabilities for, one, their reasoning to get a vocational certificate and why they got it in the first place. So if it wasn't required to get a job, then what other reason could you have gotten it for? Again, there's 10 other variables about the reason for this. But we'll see in the next slide that there is something else that comes up in a similar pattern. There we go. So again, the image on the left just shows the pattern that we saw for 9 out of the 11. Regardless of disability status, most people are saying no to getting a certification for a particular reason. But when we look at the chart on the right, we see the same shift we saw in the previous slide. When the reason to get a vocational certificate is to earn more money, we see that the majority of people with disability are responding to this question saying no. They are not getting a vocational certificate to earn money. But people without a disability, slightly higher, are saying, yes, we are getting a vocational certificate to earn more money. And so It's also still a little interesting when it comes to requiring to get a job or earning more money. We're seeing that people with disabilities are saying this is not, again, a reason why I have this. Oftentimes, though, you might think that getting a vocational certificate or some certification or licensure would be related to an increase in income. So NTEWS does not provide an answer to this, but I think it is worth noting that so far, when it comes to variables like earning more money or money in general, we have seen so far that people with disabilities are reporting no to these questions. They're not trying to earn more money by having this thing, or they did not get this thing to earn more money. And it possibly could be due to one of the concerns I brought up earlier about maybe losing benefits or not being above a certain income cap so that you don't lose any potential benefits. So in all, this variable, which is the reason for choosing a certification, vocational or license or certification, is still very valuable though for understanding motivation or potential barriers to certification, but also tracking emerging trends and informing policy on credentialing pathways and how those things can either be related to employment or even increases in employment or increases in other things like income. There we go. So now moving on to our fifth of 6 research questions. So we're nearly done with this section. In section 5, or research question 5, now we wanted to specifically look at work credentials. So in NTEWS, these are defined as people who have licenses and certifications, not vocational certificates. So slight difference. So we wanted to look at the work credential, license and certification, and the credential fields that have the highest percentage of people with disabilities. And these results are very similar to what we saw in the industry slide, where healthcare and education are one of the highest industries or credential fields employing people and workers with disabilities. So if you look at healthcare, regardless of disability status, we see that that is the credential field that employs the most people, the most people with disabilities and without disabilities. And then education is second. But then if you look at the other 3 credential fields, community services, personal care and services, and construction and instruction, we'll see that in particular, those 3 credential fields have a higher percentage of people with disability, dark blue bar, compared to their non-disability peers, light blue bar. So again, while education and healthcare are the credential fields where most people are if they have a work credential, regardless of disability status, we do see though, like in industry, there are certain areas where there is a higher percentage or slightly higher percentage of people in specific fields compared to their non-disability peers. We also see that states are the highest issuers of licenses and certification. And that makes a little bit of sense when you think about what we saw on the previous slide. In education and healthcare specifically, those are areas where most people or certain occupations in those areas would probably require licenses and certifications specifically. So it makes sense that states are the highest issuer of these things because the states are the ones issuing these licenses and certifications for some of the industries and credential fields that we saw in previous slides. Second in this, as far as issuing goes, is professional or trade association. And that makes sense as well too, because those groups offer industry-related certificates, like for manufacturing, things like that. And so some of those areas are areas that we have seen come up in previous slides. So on this slide, what I wanted to do was show 2 credential fields specifically, healthcare on the left and community services on the right. So we could see, at least for 2 areas, how license and certifications are distributed among those fields and among the jobs and careers that are in those fields. So we can see that there is a pretty big difference in the proportion of people obtaining licenses and certifications in healthcare, for example, on the left. So again, across disability status, it seems that most people in healthcare, at least from NTEWS respondents, have a license if they are working in that area, with a very small group holding certifications. But again, it's similar across disability status. But when we look at community services, for example, although the majority of people, again, across disability status have licenses in this area, it seems that there is more room for people to also have certifications. And again, you'll see the bit of the shift. There are more people with disabilities who have a license in community services compared to their non-disability peers, but they are less likely to have certification in this field compared to their non-disability peers. So not statistically significant, but still a shift that might be worth exploring. What could be driving people with disabilities to get licenses in this particular field that might be driving people without disabilities to get certifications in this particular field? Is there any barriers about why one group is higher in one or higher in the other, or anything like that? Okay, so now we are on to our last research question, which explores work experience programs. And these are the apprenticeships and the internships as described in the NTEWS. So first we just looked at, participation and completion rates of work experience program as reported in the NTEWS. And we see that the majority of people, again, across disability status, did not complete or participate in a work experience program. But if they did, there was a slightly higher percentage of people who did not have disabilities compared to people with disabilities that did complete a work experience program. And then related to that, we broke down what we had, the work experience program type. So in the NTEWS, we were able to break this down into apprenticeship, paid internship, and unpaid internship. And so overall, when we look at these work experience program types, we see that regardless of disability status, the majority of people were in unpaid internships. But when we look at apprenticeship and paid internships, this is where we see that there is a higher percentage of people with disabilities, again, dark blue bar, in those areas, apprenticeship and paid internship compared to their non-disability peers, light blue bar. So this is one of those variables that kind of can be related to earnings or money, given the paid and unpaid internship categories. And again, what we generally have seen is that there are just, in general, higher percentages of people with disabilities that are in or that are responding to questions saying that they have something that's not used for more money, more income, or not getting paid to do something. And again, we don't know why, but we have seen this trend in some of the questions. And so again, it might be related to things that we talked about earlier, benefits or income caps or things like that. But I think after what we've seen today for some of these slides, there is absolutely probably further exploration of the relationship between earnings, money, and potential loss and benefits that may be warranted. And so overall, when looking at the work experience program variables, I think these are important to help us understand where experiential learning occurs and how it might be expanded again to be a better resource for people with and without disabilities, and how that might again be related to employment outcomes or educational outcomes, or in general, just overall employment or workforce well-being. So that's it for me. Thank you everyone for joining us today to learn more about the NTEWS survey. I hope you were able to learn something new or were able to find something interesting from today's session. Please, again, if you have any questions about anything or something like that, please put them in the Q&A. And now we'll be moving on to the panel session. So I will transition and give the mic back to Daniel.
This is Daniel Van Sant from the Harkin Institute speaking. Thank you so much, Juanita, for that deep dive and reviewing this information. Really, really great content. And I appreciate you packing so much in such little time. I know that you could easily have done this presentation over the course of hours. So thank you so much for that. We do have some questions here for our panelists. So in addition to Juanita and Kathleen, I want to welcome Scott and Perry uh, onto the virtual stage here for some questions. And I do see we have some questions in the Q&A. So we'll have the four of you addressing some of those, maybe while your co-panelists are speaking. Juanita, I'm going to kick this first question to you first. I'm sorry we're not giving you too much time to rest here. But for our viewers that are kind of wondering, like this is really great data. What can we do with this? Where do we go from here? I'm wondering if you can comment on, are there any associations you see between the N2's data linking credential attainment or work-based learning to better employment or educational outcomes? What's the there with this data?
So I will be honest, there is a bit of limitation, at least for the work-based learning and the work experience program section, because there's one catch-all question that talks about work experience programs. So it doesn't get into detail much further than what we were able to get, which is the catch-all question we were able to break down into apprenticeship, internship, and paid and unpaid internship. But we cannot go deeper than that because there are no follow-up questions that help you get to some of those deeper dives. But from what I've seen, though, generally, for people who have a credential and for people who are using it for their main job, it is specifically used for that. We have a credential for this job. But there really isn't much of an association between the credential being used for their job and other outcomes like increase in income, which we saw in the slides, because people are saying, we have these things and we're using them, but it's not to earn more money. It's not to be, paid more. So NTEWS is a little limited in terms of that particular question, but I'm sure there might be other surveys that can go deeper or have more questions. Unfortunately, again, NTEWS is a pilot. In the next iteration of NTEWS, there might be better questions and more questions, but we don't have that right now. So that is one of the limitations I want to say. As a pilot, we only have the one question.
Great. Thank you for that. This is Daniel speaking again. Scott, I saw you nodding along there. And so I know our group hasn't heard from you yet. I want to give you the chance to introduce yourself, and looked like you wanted to comment on what Juanita was saying.
Thank you, Daniel. For those that can't see me, I am a white male with short hair and wearing a red sweater and a brown jacket. Generally speaking, we recognize that paid and registered apprenticeships lead to better employment outcomes. There's a more formal and tangible relationship to the employer and to the occupational work that happens. Unpaid internships do sometimes offer experiential learning, and they can teach valuable skills. But based on our team's broader experience with apprenticeship programs, paid and registered apprenticeships or internships that offer compensated instances of work-based learning will generally lead to better outcomes than unpaid internships. Back to you, Daniel.
Great, thank you. I have some other questions, of course, but Kathleen, Perry, anything either of you want to add on this point?
Not me. I can see a lot of questions. So I think since we're getting close to the end of the hour, we might want to move on.
Perfect. So Juanita, one of the big healthcare profession um, boxes that you talked about was healthcare, and I'm wondering if you could break that down a little bit. Are these nurses or doctors? What's the breakdown of types of professions in the healthcare data there?
I was on mute. Right. So this is a write-in question. So respondents write what their occupation is, and because of course that could be, you know, many variations. What NTEWS does is it takes those write-in responses and places them in larger categories and then puts an umbrella term around that. So for example, there probably are people who responded to the NTEWS that are nurses, and so they wrote in nurse. But at the aggregate level, that gets rolled up into a different code that might say something like treating practitioners. And then, of course, that treating practitioners label is what is assigned to the person who wrote nurse specifically, and then they are in the healthcare category. So again, because it's a write-in variable, we don't get the actual write-in information, we get the rolled up version. But there are 3 health-related codes: health diagnosing, health technologists and technicians, and healthcare support occupations. So viewers and listeners could better understand where nurse might fit into one of those 3 categories, and then use the results from the category that makes the most sense for nurses to be in.
Great. I know we have a lot of employers and recruiters listening here and hopefully watching the recording afterward. So, what does this data show as the biggest opportunities for employers to recruit and retain people with disabilities?
I will answer this shortly. It's some of the areas that we saw in the earlier slides. Those areas like education, healthcare, professional services, manufacturing, and retail. Those industries have had very strong relationships with people with disabilities to employ and recruit them. I can't say why some of the other categories have not had as strong relationships, but according to the NTEWS survey and the Bureau of Labor Statistics, those 5 categories in particular have had very good relationships with employing and recruiting people with disabilities or workers with disabilities.
Thank you, Juanita. Scott or Kathleen, Perry, Scott, go ahead.
This is Scott speaking. The general trend that I saw in the data presented here is a degree of parity in the outcomes, and getting a certificate or credential appears to be associated with the parity that we see. Based on the trends and patterns that I thought Juanita did a fantastic job of describing here, I would encourage people to continue to pursue opportunities that lead to credentials and certifications, and for employers to recognize these individuals as a good potential pool to recruit from. It's useful to note that vocational rehabilitation programs have traditionally prioritized and focused on short-term, cost-effective training that leads to competitive integrated employment. So these results seem entirely consistent with that longstanding policy and suggest to me that it continues to be the right way to go. I would say employers can continue to use career fairs to reach out to credentialing programs and work-based learning programs as a pool for qualified candidates, particularly in high-growth industries such as healthcare and IT. Back to you, Daniel.
Awesome. We're running low on time, but I want to squeeze a couple questions in here. What opportunities do you believe there are to innovate the job finding or career matching space based on this data? And Scott, maybe we can kind of stick with you because you touched on that in your last answer as well.
So I'll try to be very brief here. I think this could be its own webinar topic, but I think in terms of innovation and job finding, it would be really good for people to think broadly about occupational skills transferability. This is an approach to focusing on what specific skills you have earned in your training and are represented by your credentials and certifications, and as opposed to thinking about being exclusively eligible for employment in a specific industry or occupation, instead of thinking about what industry you intend to work in or what specific credential you have, you can promote to employers and in your resume the skills that the credentials demonstrate that you have. Lots of people work in industries or occupations that they're not formally trained in. And I think if people can learn to lead with the skills that they have, it will dramatically expand the potential pool of areas that they would potentially be eligible for. I don't know if Kathleen or others have things to add to that.
I do not, Scott. Personally, I've been trying to answer some of the questions that people have online since I know we won't get to them all live.
Great. Well, this is Daniel speaking, and we're wrapping up here. Perry, I just want to come to you very, very briefly. So, speaking from the sort of ERG perspective, how do you feel that this data, coupled with some emerging technology trends, are actually affecting people in the workplace?
Yeah, thanks for the question. I think that there's a lot of new information represented here. There's a lot of data that kind of backs up uh, how we're seeing technology help people with disabilities in the workforce, including neurodivergent people using AI for assistive tech. And then it also, I think it's noted that in 2040, or it could be noted, 40% of the workforce will identify as neurodivergent. So, so I think that the data kind of backs that up and it can kind of point toward that similar trend in the future.
Great. This is Daniel speaking. Thank you all. I know we could have had this conversation go on for hours, but we are at our hour here. So I want to thank AIR for working with the Harkin Institute on putting this panel together, for your work on helping us break down the N2's data. And I want to thank all of you watching this live or watching the recording afterward. I want to thank you for really engaging with this topic of how the disability field can really utilize data to not just push anecdotal evidence, but data-backed practices forward. So thank all of you for participating and watching today. As I mentioned earlier, the recording and compliant PDF of the slides will be available on AIR's website, which was shared earlier. Um, Happy National Disability Employment Awareness Month, everybody. And remember, even when October is done, we can still celebrate value and talent of disabled people in the workplace. Thank you all for joining us.